Advocacy Day here. My name is Nicole Kimball. I am the chair of the Massachusetts Commission on the Status of Women. And I would like to thank everyone for joining us here on our 9th annual and let's hope our only virtual Advocacy Day. We are very excited to discuss what we collectively can do and can accomplish today. But before I proceed, I just want to acknowledge the changed world that we are all living in and how many women and girls, particularly women of color, and many of our frontline essential workers are facing literally life-threatening situations because of this pandemic. And I'm hoping that we as a commission and our regional commissions and our partners in the legislature and other organizations are able to work together, including what we do today, to just make a difference to the struggles of so many women in the Commonwealth. So at this time, I would like to thank my sister commissioners who are serving on state, regional, and municipal commissions, as well as representing partner organizations who are participating today. We really appreciate all of your support as we continue to build networks to advocate and championing policy that addresses all of the issues and the concerns of women, in particular the things that we are facing today. So let me welcome right now my fellow commissioners, we have 19 regional commissioners, 19 volunteer commissioners on the statewide commission. So here today we have Danella Clark, our vice chair, and I'm just going to go through our list here. Sarah Schnorr is our treasurer, Rebecca Bacht is our secretary, and we also have Penny Blaisdell, Ruth Bramson, Jean Fox, Marianne Fleckner, Liz Friedman, Allison Goldberg, Audrey Hall, Patricia Hole, Leslie Ann McGee, Maria Pupolo, Marlene Soto, Shaitia Spruell, Wendy Silver, Phyllis Smith, and Meredith Tuitt. I also want to welcome today the elected officials who have registered today. We've got Representative Joan Moschino, Representative Mike Colony, Senator Susan Nichols, Representative Liz Malia, Representative Will Crocker, Representative Christine Barber, also Mayor Nicole LaChapelle of East Hampton, Aisha Miller, the Director of Constituent Services for Boston's Independent Services. And there may be other people, but I just wanted to let people know who has registered. So the commission was legislatively founded in 1998 as an independent state agency, and our mission is to seek to advance equality for women by promoting their rights and opportunities. As I said, we are 19 volunteer commissioners who were appointed by the governor, the Speaker of the House, the Senate President, and the caucus of women legislators. So right now we are certainly in very unprecedented times. None of us has faced before. This public health crisis has really upended just so much, the health of our communities, our economy. Already too many people have been taken from us whom we love. And really at this time, we are called even more to act and to address these issues. And I have to say that the commission is really very proud for the work that we have been able to do to address this pandemic. And we've been working, together with the administration and with the legislature in order to try to address needs that we have heard about. We're going to talk about that more together today, and also to recommend some solutions. And so today, we feel that our mission, which is to listen to voices and amplify the voices of women, that we are able to do that even more so than ever before with these issues that we are now facing. So with that, I'm going to turn things over to Meredith Tuitt, the chair of our Program and Planning Committee. Meredith.
Nina, Meredith may have had a complication with her camera. I think it froze.
Oh, okay, thank you. I'll tell you what we will do is let's move to Liz Friedman. Excuse me, wait a minute, Audrey Hall. I'm looking. Why don't we go to Audrey Hall, who is the next person who's going to be presenting, and then we're going to go back to Meredith. So Audrey is the chair of our action committee, and she's going to talk to everyone about the report that we have done. Audrey. And Audrey, I can't hear your, Audrey, you might be muted. Audrey, are you muted?
I am not muted. Jill, can you please unmute me?
I can hear you now, Audrey. Great.
Okay, great. Thank you so much. I want to say good morning to everyone. It's great to be here with all of you. I'm very, very excited to talk about our report because it's so informative and it covers so much that needs to be discussed. As many of you may recall, on March 10th, Governor Baker declared a state of emergency in response to the coronavirus outbreak. And shortly after that, he also gave state organizations the opportunity to meet remotely and conduct business virtually. And so on March 26th, we as the Massachusetts Commission on the Status of Women met in our first virtual meeting, and we formed an action committee. And I was honored to be chosen to chair that committee. Shortly after the committee was formed, and in alignment with our statutory charge, which is to report on the status of women in the Commonwealth and give the and make sure that women and girls' voices are heard. And given the current crisis, we determined that it was appropriate and necessary that we offer information about how this pandemic is impacting women and girls to support the work that our legislators do on behalf of everyone in the Commonwealth. And so with this action committee, our focus was on that. And we decided that we were going to do two very critical things immediately. We were going to conduct a virtual public hearing, and we were going to create and conduct a survey. And the hearing would be conducted, as I said, virtually, and the survey would be distributed and made accessible online following the hearing, immediately following the hearing. And the information that the commission collected is now captured in our report, which hopefully all of you have seen, and if not, I want to make sure that everybody gets a copy. And we offer it to you so that it will serve as a resource as public policy responses are being developed. And it represents input from women and girls in over 250 cities and towns in Massachusetts. So the outreach was broad, and we were very happy to show that 250 cities and towns were a part of this data. So I'm going to start by giving you an overview of the hearing. The hearing was conducted on Thursday, April 2nd. And so we probably want to back up a slide to go to the hearing. There we go. Thank you. And when the hearing was conducted, we had over 100 attendees. And members of the public at that time shared information on a range of issues. And the hearing was widely publicized using social media and email. And a couple of things that we also did to supplement the hearing, we invited people to provide testimony during the hearing and also written testimony after the hearing. It was not closed out. People really wanted to talk. They wanted to share what was on their minds, and we took written testimony from many, many people. And we collected all that written testimony leading up to as well as after the hearing. And at the end of the hearing on April 2nd, before we closed and signed off, we announced to everyone that we were conducting a survey. And then we blitzed the survey starting April 3rd on social media and through email using a Google survey that we had created. And the survey asked about 12 questions, informational questions, and also demographic questions. And I also want to let you know that when we conducted that survey, we didn't want anyone to feel that their privacy was being sacrificed in any way. We provided a lot of options, and we gave people the opportunity to select more than one They were multiple choice questions, but every question had an other category. Every question had an I prefer not to answer this question selection, and everybody was able to select as many as the options that applied to them. And then, of course, the same for the demographic information. And so the survey was only distributed in English because of our short time frame, and we know that that impacted the results. And we hope that in the future, if we pursue this, that we'll do it in multiple languages. The survey gathered data between April 3rd and April 9th. So I want to make it very clear to everyone that this survey is a snapshot in time at an earlier stage in the pandemic. And just so that you know, the response was overwhelming. We had 2,523 responses to the survey. And so then we took the testimony from the hearing and the survey, and we started to analyze the data, and we saw that it indicated we wanted to compare it. Let me backtrack for a moment. I'm sorry. We wanted to compare it to the demographics of the state overall to see how our survey respondents compared to the demographics in the state. And we found that they were very closely aligned. And that demographic information is also included in the survey. And I just want to say at this point in time that due to the fact that the survey was electronic, due to the fact that it was only in English, and due to the fact that the people that participated were not selected based on meeting any particular criteria, the survey cannot be considered to be a scientific study, but obviously it's a very good gauge, especially due to the breadth of the reach throughout the Commonwealth of what was happening at that point in time. And so it's a solid indication of that period of how things evolved with this pandemic, and then where they were starting to head. So our report combined the testimony, and then we broke it into 5 categories. Those 5 categories were, and we can move on to the next slide, I believe: economic impact, health issues, domestic violence, essential workers, and incarcerated women. And this graphic on the left highlights some of the key findings in each of those categories, but I'm going to discuss a few of them with you right now. In the category of economic impact, by that early stage in April, 11% of survey respondents had already lost their jobs, with 14% of those were citing an income loss of $250 to $500 per week. 33% of all respondents selected a desire for housing assistance from the state in the form of a moratorium on rents, mortgages, and utility bills. With regard to food insecurity, 1/3 of the total survey respondents reported not being able to afford or access food, or having difficulty accessing food, and 57% of those had dependent children. In the hearing, we also heard more detail about WIC items in the stores being out of stock on the shelves, leaving little choice for those people limited to WIC options. We also heard that school department meal distribution, which is happening in many communities, is happening during working hours. Usually the hours are like 10 to 1 or something like that, and that makes it very difficult for essential workers to access the food that's being provided through the school departments. Additionally, 37% of survey respondents were concerned about a loss of savings. And we heard people talk about opening credit card accounts to pay for things and taking withdrawals from 401k accounts. And when they were asked about financial and housing issues that exist as a direct result of COVID-19, the highest levels of concern were paying utility bills, student loans, and rent. Moving on to the health category, this section covers mental health, access to health care, racial disparities, pregnancy and postpartum care, and reproductive health. An alarming number, 43% of the survey respondents reported experiencing anxiety and depression. And we heard in the hearing from testimony that there was this increase in social isolation for seniors, often women living alone, unable to have visitors, was very difficult, and how social distancing is especially difficult for girls who base their self-worth on the relationships that they have with others. With regard to accessing health care, 9% of survey respondents were having difficulty getting the care they need, and 20% reported that they were using telehealth for their health care needs, although that rate was lower for women of color, and of course, restricted access for those who didn't have access to the internet. We heard about racial disparities in healthcare. Testimony emphasized the impact of gender bias on critical health services, impacting how low-income women and low-income women and women of color. And one participant made the point, a very important point, that the virus does not discriminate. Health equity is more important now because we are all equal. And moving along to additional results here, talking about postpartum mothers, 34%, and pregnant women as well. 34% of pregnant women were told that they might have to deliver their babies without a partner, a doula, etc., during their hospital stay. And they were also very concerned about infection while in the hospital. And this led some women to start to plan for alternate care. But their options were somewhat limited, especially for those who were having complications during pregnancy, and those women who wanted to maybe arrange for out-of-hospital childbirth were concerned about insurance coverage and midwife services and access to options outside of the hospital. So this was compounded financially for pregnant essential workers who are recommended to stay out of work due to exposure, but can't because they don't have paid leave. Now, we all know that reproductive health is time-sensitive and essential. Menstrual cycles and pregnancy continue in spite of a pandemic. And hearing participants voice concerns related to increased lack of access and delayed medical treatment, and the challenges faced by women and girls increase risk and take away choice and control of their bodies during a period like this. In the category of domestic violence, hearing participants reported an escalation of violence, and they were talking about how COVID-19 is being weaponized by abusers, meaning that home is not always the safest place. And survey respondents shared information regarding the dangerous intersection of increasingly limited housing options and the existence of the threat of violence. 14% of survey respondents reported that they were essential workers, and 30% of them are in the 35 to 44-year-old age bracket. 58% of those essential workers are also providing care to a dependent child or a family member, with services to support that care becoming very limited or even inaccessible, totally inaccessible. Given a choice of potential aid from the state, essential workers showed a greater need in these 5 categories as compared to the overall survey respondents. A one-time payment to help with expenses, a moratorium on mortgages, rents, and utility bills, a moratorium on student loans, income tax relief, and access to health care. Testimony at the hearing highlighted a distressing situation for incarcerated women. Incarcerated women, including those being held in pre-trial, who have not even been charged yet, are currently facing greater chances of contracting COVID-19 due to a lack of social distancing in prisons, a lack of PPE, and a lack of basic necessities like toilet paper, soap, and access to healthcare services. One hearing participant said decarcerating prisons should be a part of our public health response to the COVID-19 crisis. In response to the testimony and survey data, the Commission has included a section in the report that we titled Areas for Immediate Attention, and this section is broken out into the categories I just reviewed with you, along with the work of evolving key government initiatives and policies and legislation. Our next steps are to include further outreach and provide updates on current challenges and obstacles that women and girls face in the Commonwealth. We are very thankful to, and we commend our legislators who have already taken action to address some of these critical needs. We thank you very much for your interest in how this pandemic is impacting women and girls in the Commonwealth. And now I'll turn this over to Commissioner Liz Friedman, who is also the chair of our legislative committee. Thank you.
And I, in turn, will turn it back to Meredith so she can make her important remarks.
Okay, yep. Hold on. There you go.
Thank you, Meredith.
Can you hear me? Good morning, good morning, good morning. Welcome everyone. I do apologize that we had to skip out of turn a little bit. Of course, you know how technology can be. I got kicked out, so I had to come back in. I'm pleased to be able to be here with all of you today. Look, we're topping almost 100 on this Community Activism Day. This is beautiful. As Nina shared, the commission was called to amplify the voices of women and advocate for the advancement of women's rights and equalities. Again, for those of you who don't know who I am, my name is Meredith Tuitt. I'm commissioner here on the Massachusetts Commission on the Status of Women. I'm the chair of Program and Planning Committee, and that's the committee that plans the events such as the hearings and Advocacy Day and our heroine events and so on. So I want to welcome you here. I want to thank my regional commissioners that are online. I see Ashton, I see Tina Gaines, I see Michelle Keith. I mean, we have 11 regionals, and I think it's phenomenal. On all the 11 regionals, we have 9 members, except for Cape and Islands has 13. And I see at least half of each of those regional commissioners are here with us. I want to thank you guys for being here because this is a partnership. We are working together across the Commonwealth. Community engagement is vital to our ability to carry out our mission. We've learned so much from the local public hearings that we host, and we are eager to have an opportunity to relay the needs, wants, opinions of women and girls across the Commonwealth to our state legislators. The public hearings offer us the opportunity to join with other women coalitions, regional and municipal commissions. The partnership and knowledge we value immensely. In order to create our program and policy agenda, we work with our regional commissions and we focus our goals of legislative advocacy and make the appropriate recommendations to our state legislators around what we learn from everything across the region. As always, this year, we scheduled to host 4 public hearings. And of course, we started Great Barrington, then we went to Weymouth, and then we went to Springfield. Our last hearing, we were supposed to go to Lynn at the end of March. Of course, we had to cancel because of COVID-19, public gatherings, and, health risk. And of course, now we know we've ventured into this virtual world, which I'm enjoying. So in the past, the hearings had been open and our advocacy day was open for discussion. The commission determined that we needed to ask about the impact of COVID. As you know, my sister Commissioner Audrey just told you what we were able to do with that. And in a moment, we're going to go back to our legislative chair, and she's going to give you some more about the legislative work that we are focusing in on. In the meantime, allow me to thank everyone again for being a part of this advocacy day, this virtual advocacy day. And also I want to invite you guys to take part in the community meetings that we're going to be hosting. We have one tonight at 7 o'clock, which is the greater Boston area. We have one tomorrow at noon, which will be covering the Central Mass area. And that'll be hosted by two of my sister commissioners, Audrey and Ruth, and regional commissioners, Heather and Tanisha from Metro West and Worcester. Then again at 5 o'clock, we'll have Western Mass, and that'll be hosted by my sister commissioners, Liz and Shaitia, and the regional commissioners would be Dawn from Hamden, and then some people from Berkshire will be joining in. And of course at 7 o'clock, which would be the South Shore, the South Coast, and the Cape and Islands, that would be hosted by my sister commissioner, Nina, who's the chair, and Jean Fox Jean is originally part of our Bristol County Regional, and her counterpart, Michelle Keith out of Bristol, will be on, and also Anna and Lisa would be there from Cape and the Islands. And then Friday at noon would be the North Shore, which is being hosted by our Maritime Liz Hart, Sister Commissioner Mary Ann, and Marlene. And I hope you guys join in on the community meetings also, because this is going to be our way to be able to get more feedback, more data, because we're shifting to data this year. We're all working so hard around getting more data, especially now during the COVID-19 pandemic. And I want to say thank you for being here with us. And I'm going to turn it over to my sister commissioner, Liz Friedman, who's our chair of legislative committee, and she's going to take it from here. Thank you so much.
Thank you, Meredith. Can you hear me?
Oh, you know what, Liz, don't forget to talk about the girls listening sessions also.
Go
I'm going to remind all of you guys to do that.
Don't forget that. That's so important. Go ahead.
Thank you, Meredith.
Are you going to go ahead and do that, Meredith, right now? You're muted, honey.
Hold on. What happened?
Do you want to
Can
share
you hear
about the
me
Girls
still?
Initiative right now? No, you're muted again. You're muted.
Why don't we do it at the end?
Right.
Do it at the end? Okay. Is that all right? Then
Yes,
I will.
Liz. Yeah,
Then I will
let's
go.
do it.
Okay.
Liz.
All right. Great. That's so important. We want to make sure to tell everybody about the amazing work that the commission's been doing in partnership with the regionals. Welcome, everybody. Thank you, Meredith. I'm Liz Friedman. And people can hear me, yes?
Mm-hmm.
All
Yes.
right, good. Just checking before I get too far in. And I want to thank each of you for joining us today. The numbers that Audrey shared with us earlier paint a picture that we may already have known. We may have already known it in our hearts, that women are carrying the brunt of the burden during the pandemic, that women are the frontline workers, the home aides, the cashiers and grocery workers, the workers in our nursing homes, as well as nurses and doctors in our hospitals, that women are providing the majority of at-home care, taking care of children, our elders, and those who are sick. And that women are losing their jobs at higher levels than their male counterparts, white women more than men, Black women more than white, Latina women more than Black women. And that Black and brown women are suffering at far higher levels, many having COVID in their communities, experiencing loss of jobs, lack of resources and commitment and burden of caring for their families and neighborhoods. We just have to say this directly. Women are bearing the brunt of the virus right now. So not only is this an unprecedented time in terms of the virus and its horrifying impact on all of us, this is an unprecedented time in terms of what is necessary in our world to address the inequities that have always existed in our society and are so greatly inflamed by the virus. Inequities caused by sexism and by racism have impacted the women of the Commonwealth in ways that have always been unacceptable, and today are of such blatant proportion that we cannot and we will not turn our eyes away from it. This is why our advocacy is not just more important than ever, it's essential. We are essential workers in the work towards equity. We are the essential minds that must engage with our legislators. We have the essential hearts that break because of the burden in our communities and the death of our loved ones. And we have the essential rage necessary to rise to action. We have the essential eyes that will not look away. And most importantly, we have the essential ability to act, to advocate, to organize, to ensure that our priorities are the priorities of the Commonwealth. We need our legislators and leaders like we have never leaded them before. And to all of you who are on the call, our leaders are in elected positions and aides, we're so grateful for you to be here with us today. And I will tell you this, our legislators and leaders have never needed us like they need us now. They need our leadership, our ideas, our support, our initiative, our friendship, our partnership, and our alliance. We have an opportunity, the likes of which I believe we have not seen in more than a generation, to recreate the world so that we can have true gender equity for every woman and girl in the Commonwealth. And we can set our mind on ending gender inequity and hold in the heart of that fight the racial inequities that have always made Black and brown women experience gender inequity at far more significant levels than their white counterparts. So here's how we're going to do it. We're going to each remember our own significance. I know that each of us has a picture of our own power, or quite frankly, you wouldn't have taken out the time to be here today on this call. I know that as much as you experience your own power in the world, that you are even more powerful than what you've been able to manifest so far and imagine up till now. And I'll tell you this also, there's no more time to wait for us each to get over whatever remains of our imposter syndrome, or the timidity and the wait our turn stuff that we might have been raised on, or the being quiet because we think others know more. Our time is now. And we need each of us together standing in our full power to get to where we want to and need to go. So remember that you in particular are significant here. And I don't know your personal story, but you know it. And you know what you've survived. You know that you've always done the very best that you could do to move things forward. And here we are again for another day of doing everything we can to move things forward for women. We're going to act on the fact that we each are essential to ensuring equity for all women in the Commonwealth. We're going to remember that we already know many things, have much expertise about how to ensure gender equity. And we're needed at this moment to share this knowledge and partner with our legislators. We are going to seek our legislators out as true partners and back them and give them what they need to be our partners in this fight. And we're going to remember that they need us and that they want us and that we can be important to them and together be a team. So here's what I know about each of us on this call. We've decided to give our time to this pursuit of justice for women. We've given our time, our sweat, our heart to the vision, and now is the time to put all of that into action. And what I want you to do more than anything is to go into your meetings with legislators, knowing that you are the partner that they need to meet the goals we all have of ensuring we come through this moment together and in better shape than we started, with gender equity at the heart of how we set our priorities. Because when women thrive, families can meet the challenges before them. When women are healthy, communities have the strength to handle the storm. When women are treated with equity, our economy has stability. And when women have security, children can play and learn and be free. So here's what I want us to do in these meetings. I want you to do you. I don't want you to be Nina or Audrey or Meredith. I want you to be you. I want you to know that when we speak about the Commission on the Status of Women, we are speaking about us, each one of us together. And we get to talk about what we care about, to speak to what our priorities are, what compels us, what we fight for. And here's the punchline. Whatever you say, put it in the context of COVID. If you care about menstrual equity and access to menstrual products, then talk about how girls and women aren't able to access what they need now, how the shelters and food pantries don't have these products, how periods don't stop because of COVID. If you care about incarcerated women, talk about the horrible current situation, the rising number of illnesses and deaths, and the rapid spreading of COVID, and how important it is to decarcerate right now. If you care about ending violence against women, then talk about the incredible danger for so many during this quarantine, having to shelter with abusers, and about how shelters need more resources to address the dire situation immediately. If you care about maternal and infant mortality, health disparities in birth, and access to midwifery care and doula care, then talk about how women are terrified right now to give birth in hospitals because of COVID, and how the risks are even higher for brown and Black birthing people, and that we need to ensure that they have the support they need and that they can have safe births at home. If you care about housing security, talk about how we must ensure that people don't lose their homes during COVID, that they need the right to have free counsel during eviction proceedings, a halt on rents, and not lose their ability to stay in their home. If you care about food security, then talk about how the mothers in your community are having challenges feeding their children, how we need increases to local food security, and that food must be a priority. If you care about economic stability, then talk about how because of COVID, families are in financial crisis and need student loans put on hold, access to emergency cash assistance, ability to use SNAP to do pickup and online delivery, and short-term relief for families in deep poverty. If you care about universal childcare, then talk about how we can't open up our economy unless we ensure that mothers have safe, affordable, and high quality childcare for every child in the Commonwealth. If you care about equal pay and sexual harassment and protections for pregnant workers, talk about how women are losing their jobs at higher numbers, being put in risky situations and are underpaid, and that our return to the new normal as we open the economy must be predicated on equity for women workers. And if you care about the access to abortion and the Roe Act, talk about how important it is to ensure that girls have access to abortion during COVID without needing to get to courts when they can't secure parental consent, or that abortion access must be provided to women who have fetal anomalies because it is unsafe to travel to Colorado at this time. And then after you've told them about what you care most about, ask them for their help and be specific. Will you join us in making sure women are more secure, protected, have access to healthcare, livelihood, and stability? Advocacy is the work of the heart. It's essential work. It doesn't get done without all of us. It's a community project. And what's quite remarkable is that even with social distancing, we have all the tools we need to still have enormous impact. I know these have been hard days, and not just for those who we advocate for, but for us. We've had losses that have brought us to our knees. And I also know that the human spirit has risen to challenges as great as the one we are currently facing. And we can rise to this, but none of us alone, only all of us together. So no, you are an essential part of this, the Massachusetts Commission on the Status of Women. And when you go to your meeting with your legislators, or when you send an email or you tweet, remember that at this moment, you get to play a key role in connecting with another human, with a legislator who, just like you, is overwhelmed, carrying a heavy burden, and wants to ensure the most good for the most people. And remember this also, not only the virus is spread by human to human connection, so is love, so is compassion, so is commitment to justice, so is courage, and so is the ability to persevere and to rise to advocate for what is most important. Now I'm going to hand you over to my sister commissioner, Shaitia Spruill. She's clerk of the legislative committee, works closely with me, a champion in a million ways, who I am so delighted that I get to partner with, and who will share with you how we're going to advocate together over the next couple of days.
Thank you, Liz. Before I jump into my section, I just want to acknowledge and thank all the partners that are joining us today. A lot of this work we can't do without our partners, so thank you for joining us. So yeah, I'm excited to talk about this opportunity to advocate. We have a range of experience. I know we have people who have worked with electeds for years, and then we have people who also consider themselves new to advocacy. And then, of course, there's everything in between. So thank you for joining us today. Thank you for advocating. Regardless of the status of how long you've been advocating, we hope that we all can agree that you chose to be here because you believe in these issues, you believe that these topics are very important, and you just felt compelled to act. So thank you again. All of my seasoned advocates, thank you for all of the work that you've done and continue to do. For everyone else, please allow me to encourage you and empower you to take this time now to advocate. If you haven't, consider yourself, consider a time you yourself advocated for a community member, a family member, for yourself. Consider a time when you may have gone to a school committee meeting or a public hearing and spoke out and advocated for an issue you cared about. Maybe addressed a concern at work, and you know, any of those kind of experiences you can build upon in this moment of advocacy. As previously noted, you know, I'm so sick of the word unprecedented, but we are in unprecedented times. But this is a time of advantage because we can now use this time to change and pivot our advocacy tactics and strategies. And also keep in mind that these public officials are overtime. They're working overtime to address the constituent concerns and the requests that are coming through. So we definitely need our approach to be not only productive, but cooperative with the people that are working. So we all know most public officials are interested in serving our communities. They're ensuring that the people of their community and our communities are fairly represented in the policy decisions. And you as a community member have a responsibility, right? We have to stay engaged in the conversation, especially if we want to be represented in those decisions. We also have to stay not only engaged at the state level, but at the local levels of our government as well. It's required of our democracy that we as citizens, participate in the governance. So that brings me to how we're going to advocate today. We know that there are many, many ways that you can advocate, but today we're going to focus on two. The first one is going to be our mini social media campaign. And the second is those virtual community meetings that Meredith had mentioned earlier. The goal is to highlight these issues that we've been talking about since this crisis started, but also all of the issues, like Liz said, that we are passionate about and the things that we care about that are directly related to the struggles that we're seeing in COVID-19 times. We also want to share info about your lived experience, because that will help our legislators develop policy that best meets the needs of right now. The needs for you, me, us, our families, our friends, everybody. So the Twitter storm is what we're calling it, is that virtual advocacy online, that mini social media campaign I spoke about. You should have received a link to the toolkit. If not, you will. First, you will see the best method of communication to legislators, and we'll have either and or Twitter handles and or emails for legislators. And if you don't know who your legislators are, there's also going to be a link for a way to find your legislator. It's called Find My Legislator. And you can identify your district senator and representative. This link will also show the bills that they sponsored and co-sponsored, so you can see what they've been working on and help you identify which bills can best serve you in your area. You'll also see the suggested hashtags, wow, that's a tongue twister, and pre-written tweets that you can use when you're connecting with your legislators, especially on social media. Those tweets and hashtags should be also tagging the legislators if you have access to their Twitter handle. You want to express your concern, but you also want to be an example and encourage dialogue between legislators and constituents on a virtual platform. We really, really, really want to emphasize virtual advocacy and using this time of virtual time to continue to engage constituents, and just make sure that they are hearing what you're experiencing during this time. And we at the commission, we also want to see what you're passionate about, what your concerns are. So please, please, please don't forget to tag us at MCSW, and as you tweet through our hour. We're also on Facebook too, so if you're on Facebook making these messages, tag us. The second part of this virtual advocacy is the virtual community meetings. You should have received an email. If you haven't, there's still time to register for a community meeting in your region. We broke them down in 5 parts. Meredith mentioned it all earlier. We have Western Mass, Central Mass, North Shore, the greater Boston area. And then the 5th one is South Shore, South Coast, and the Cape and Islands. These conversations are supposed to be a place where we can bring together community members, staff of those legislators themselves, and those movers and shakers in the areas that you are from, to have a healthy conversation, a good conversation about what's going on, what you're experiencing, so they can hear it from the people that are electing them, that they are representing. This will also allow legislators to learn about the efforts that are already being led by our regional commissioners or commissions. And it's just a really good opportunity to use this time to advocate. If you got them in the room, the virtual room, you should use that time and tell your story. Like I said, if you're not registered for any of these community meetings, there's still time. We have posted them in the chat. They're posted on our social medias. I know that a lot of the regional commissions have already dispersed the information, but there are so we'll definitely help you get registered if you are interested. And then finally, oh, like I said, if you aren't registered, you will have access to that after the Twitter storm. And we hope that you guys stay engaged, and we'll see you soon. I'm going to pass it off to my Vice Chair, Danella, Ms. Danella Clark.
And actually, before
Thank you
Danella
so-
starts, yeah, go ahead,
Thank
Danella.
you so much. Thank you so much, Shai, and thank you all for joining us this morning. As Shai said, I am the Vice Chair of the Commission, and so happy to be with each of you this morning. Before I close us out, I want to go back to our Chair, who really has led today's effort, Meredith, to talk about girls, as well as to recognize some folks who've joined us later. Meredith?
Yes, thank you, ladies. I just wanted to come back and talk about the girls' listening sessions. And thank you, Vice Chair Danella, for letting me jump back in front of you. I wanted to definitely thank Chairwoman Liz Malia's Chief of Staff, Natalie Kaufman, for being online with us. Representative Malia is chair of the Women's Caucus and also chair in the Ways and Means. We have Representative Barber that is online with us. I want to thank her for being here. And also Nicole Stevens, the Executive Director of the Women's Legislative Caucus. This is a strong partner for us. So I just wanted to mention those ladies. For the girls listening sessions, we hope we are going to share all of the information with you guys also, but we hope that you'll be able to get your young sisters to log in with us. Starting on the 19th, we're doing middle school and high school listening sessions at 3 o'clock, and at 5 o'clock, it's an hour-long slots for each of them, and 7 o'clock also on Tuesday, the 19th. On Wednesday, the 20th, again, high school and moderate age young ladies, the ones that are just getting ready to go into college, that start at 3 o'clock, again at 5, and then at 7. Then we have on the 21st is our college young ladies and so on. At that age, we try to break it down so that it'll be same hour long, 3, 5, and 7. And then on the 26th, we're going to do our college age again. Again, we start at 3 and then again at 5 and at 7. So we hope you'll be able to really log in with us and be able to have your young sisters join us on those dates, the 27th and the 26th, 27th, and 28th, the week after Memorial Day. Those 3 days, we're also up and running. We want to hear from our young sisters across the Commonwealth, because it's about women and girls here. So I want to thank you, and I'm going to turn it back over to our Vice Chair to go ahead and close us out. And as Shaitia says, and all of the sister commissioners before, please join us from 11 to 12, our social media outreach and doing our Twitter feeds and so on. So all of that stuff was in the toolkit, and we'll share all of that information again with you at the end. Thank you, Sister Danella.
Thank you so much, Meredith. This will be a little bit different of a closeout. You all have received a tremendous amount of information this morning, but can we just pause just for 30 seconds and just center a moment of silence, if you will, for all those that we've lost, not only in our great Commonwealth, but also the country. So let's just pause for 30 seconds. Thank you. Thank you so much. for doing that. I just want to end with saying thank you. Thank you to each and every one of you. I often say that life is a choice, and you could have chosen to be anywhere this morning, but you have chosen to be advocates, to be here with us, to hear of the work of the commission, to, as Liz said, to raise and elevate your voice. Our Commonwealth needs each and every one of you more now than ever. We need you to stay engaged. We need you to raise your voice. We need you to advocate on behalf of all the women and girls all across our Commonwealth. We know that Massachusetts has been on the forefront. We lead in many, many categories, and we want to continue to do that. We will get through this. We will get through this together. Brighter days are ahead. But what we want to ensure, many of the challenges of COVID-19, particularly related to communities of color, were here before this. We want to come out of this stronger, more knowledgeable, and better than when we went into it. And I know that with each and every one of your help, together we can do this. So thank you, thank you, thank you again for choosing to spend some time with us. Thank you for being an advocate on the front lines for women and girls all across our Commonwealth. And with that, I wish you all a great day. Thank you.